Endometriosis occurs when endometrial-like tissue from the lining of the uterus grows on the tissue of other organs surrounding the uterus. During menstruation, the endometrial-affected organs become inflamed since it cannot flush out the endometrial-like tissues growing outside of the uterus. Endometrial-like tissue starts to become scar tissue, fusing together other organs, causing pain due to affected organs. According to womenshealth.gov, endometriosis affects more than 11% of American women. It can affect women from ages 15 to 44, but is most common in women ages 30 to 40. There is currently no reason or cause for the development of endometriosis. Current risk factors for endometriosis may include family history of endometriosis, menstruating before age 11, length of menstrual cycle, and defects in the uterus or fallopian tubes. How did you find out you had endometriosis?
I actually found out because I was having really painful periods, and I went to see a OBGYN, and we had a laparoscopic I believe it's like a laparoscopic discovery procedure, and that's where he was able to diagnose me with endometriosis.
In majority of cases, diagnosis for endometriosis starts with symptoms. Most women experience painful menstrual cramps during and after sexual intercourse, painful bowel movements, abnormal bleeding, and infertility. Some providers will perform a pelvic exam. An MRI can be ordered to map the endometriosis. For a more definitive diagnosis and treatment, a laparoscopy can be performed. What organs did endometriosis affect in your body?
As of 2018 to 2019, I actually have stage 4 endometriosis, which out of the 4 stages, 1, 2, 3, and 4 is like the worst one that you can have. So my ovaries, my fallopian tubes, the tissue inside of my uterus, the outside of my uterus had endometriosis, my bladder, my bowels, and also like in the rectal region.
Endometriosis can be found in the ovaries, fallopian tubes, tissues that support the uterus, digestive organs, and other neighboring organs. How many procedures have you had in order to treat endometriosis?
At the time, because excision wasn't very commonly known as the correct way to treat endometriosis, I would get ablation surgery, which is basically where they only burn off the endometriosis. And so I've had 5 surgeries for it so far, like in my lifetime. One when I was 15, another one 2 years later, I believe another one like 3 or 4 years later, and then I had another surgery just this year.
In less severe cases, to suppress hormones, doctors may recommend birth control, gonadotropin-releasing hormone medication, or danazol. In more severe cases, doctors may recommend surgeries such as laparoscopy or hysterectomy to treat endometriosis. Since endometriosis is a chronic disease, symptoms can reappear after a few years.